topic is called QMS Foundation, and QMS stands for Quality Management System. Now, I mean, I realized in my experience that whenever we implement a quality management system in the hospitals, there are multiple actions or activities that we perform as part of managing quality in our hospitals. So we have small issues, for example, handling the quality tools, or we may have issues like how to design a questionnaire. Now, this is something that is done fairly regularly. On lots of occasions, we are required to prepare a questionnaire, collect some data, and carry out studies, whether it is for the purpose of obtaining the patient feedback or for patient-reported outcome measures or for experience measurements, or even for, let us say, when you do a clinical audit. Essentially, in clinical audit, we look at a protocol or a best practice or a consensus guideline, and then we look at that guideline and make a a data collection format based on that. So, in many occasions, the clinical audit also or may also require a questionnaire. So, how to make a questionnaire is something that we all have to understand, and we all need to really know how to design a questionnaire, what are the important aspects of making a questionnaire, and what makes a questionnaire a good questionnaire. All of us do that. We have in our hospitals, all of us have designed patient feedback forms. We have designed many such instruments and tools that we have used for collecting data. Questionnaire is one of them. So this is a separate series. At least once a month, we will have one session on QMS Foundation. We are beginning with today's presentation, which is on questionnaire. So this is a topic, this is a requirement that comes up lots of times. And in fact, whenever you have a question that, okay, let us measure the patient feedback, or we need to design a feedback form, or you're collecting data for many purposes. A lot of us also conduct research studies. We may be doing it as as students in the postgraduate medical programs, so MD, MS, DNB, or we may be conducting a project. A lot of us are from a lot of us have done MBA in healthcare management, and almost all MBA programs have a project completion requirement. And those projects also many times depend on questionnaire as a tool for collecting data. So questionnaire is an important how to make a question is an important skill. It requires us to be clear as to what we are trying to gather as data and how we are going to use it. So that is the reason why we have selected today's topic, and how to make a questionnaire, and some important aspects of that we will cover. There are two aspects of reliability and validity of a questionnaire. Now, this is one subject for which we will need to conduct a separate session by itself. So it is listed, so we will sometime we will do that. But validating a questionnaire and testing the reliability of a questionnaire are two separate requirements, which we are not covering today because of the time constraint. So let us begin with today's topic, and the scheme of presentation will cover these three aspects. The data collection in hospital management. So as a managerial function, we need to collect data, because as a managerial function, we will be required to take decisions based on many things. Those decisions could be to improve the patient's experience. So you need some data for that. Those needs could be to improve the patient's satisfaction. You will need to carry out a survey regarding your own services. So for whatever purpose, you need a data collection system in your hospital. And for clinical audits and for many things, we collect data. Next, we will address the questionnaire and the question types. So what are the types of questionnaires and what are the types of questions within a questionnaire? So we will address these two things, and we'll then see how to design, select and design a questionnaire. So these are the three broad areas that we will cover. So leading teams and managing organizations. I think in hospital management, all of us do this. We lead teams. Those teams can be temporary or permanent teams. We manage organizations or parts of organizations or departments. And when we do that, we need to measure performance. We need to measure the outcomes, the processes, and people. Essentially, these are the aspects which will be required to firstly know the level of our current functioning or current performance and to find out ways and means to improve. So for this purpose, we use a large number of tools because the data needs to be collected and that data collection be will require some tool to be used. So can we collectively name some data collection tools, some examples? Anyone? Questionnaire is one that I've already discussed. What are the other tools for collecting data? Anyone? No? Okay. So let us look at the data collection tools that we can deploy when we collect data for any purpose. So we can do an interview and note down the answers that we get from interviewing a person or a group of people. We can use a questionnaire, and we will discuss that tool today. We can also have a reporting system. So you establish a reporting system, and then this periodically, for example, your bed census, how many beds are occupied today in the hospital, the bed census is reported daily. So it's a method of reporting. Similarly, you can establish a variety of reporting systems where these reports will come to you, and that will form or that will become your data collection tool. Then you can do what is called mining the existing data or mine the existing data. Now, mining means that you have a repository, for example, your MRD, and in the MRD, you want to study a particular aspect of, let's say, patient care service management or services management or a clinical care. So you take those documents or take those records, and from those records, you take out data which will be which can be called a data mining. You can also have let's say EMR or EHR, the electronic health or the electronic medical records. Those databases can also be used for mining data. Then you can carry out observations. So here you are not asking any question or you're not interacting any question, you are merely observing it. So we do the hand hygiene observation. That's a method of data collection by observation. Then we can also have focused group discussions. So focused group discussion is where you have an expert group, and that group is put together. They they discuss a particular subject, and then they come out with inferences, and those inferences are then used for decision making in the management. And then we can also have a combination research where interview plus focused group or one or more than one tool are combined together, and then it is used for collecting data. So these are some of the methods. There can be many more methods depending on what kind of data you are collecting. For example, if you want to know the validations in the CSSG, you will possibly take the printouts from the autoclaves where you have the recording of the temperature and the holding times. So that is another way of collecting data. So we essentially need a tool for collecting data, and questionnaire is one such tool about which we will be talking today. So a questionnaire offers an objective means of collecting information about people's knowledge, beliefs, attitudes, and behavior. So what are the kind of objectives we have? So we want to know, do our patients like our service timings? How do we know that? So we ask patients, and how do we ask? We use a questionnaire. You can also use an interview, but questionnaire can be used. Then what do staff think of the new staff engagement initiative? So we have another one initiative in the hospital we are planning, we are thinking, or we have already piloted it. And so what is the feedback from the staff? So you need a questionnaire to collect that feedback. why don't staff wash their hands properly? So if this is your current issue to be resolved, we need to know why is it happening. So one way is that we do observation. The other way is that we have a questionnaire and we collect information. We ask people as to why is it that people are not washing their hands properly. So depending on the question, depending on what we want to investigate or about what we want to know more, we frame that question, and based on that we make a questionnaire out of that to collect data. So questionnaire can be used as the sole research instrument. So mostly in biosocial research, and the hospital management is a biosocial research. So in biosocial research, it is many times used as the sole instruments. Now, in almost all the MBA healthcare projects, or in the projects that the institutions or the universities or the colleges assign to the MBA students, they conduct they make a project, they conduct some research, and that is, and if it is a questionnaire based, then in those in such studies, question is the sole source of data that particular study will have, and it is a kind of a biosocial research, and which is different from the other varieties of scientific research. Biosocial is also scientific, but this is to do with the management, which is considered a social science. So, and the questionnaires are also used within the clinical trials or within the epidemiological studies. So, you may have a large epidemiological studies. For example, COVID-19 is being studied extensively now, and within this large epidemiological study that you have designed, you have some components about which the data will come via the questionnaires. So, questionnaire is in common use. That was the point I am trying to make. Now, there are detailed guidelines already available about making a questionnaire, and yet the methodological errors, the errors in the method deployed or used for making a questionnaire, and the resultant data are many times there are serious errors. In my personal capacity, I also teach in Symbiosis University in Chitkara and in IIHMR. A couple of modules I take for them. So when I am evaluating the projects that the students have made, a large number of projects are based on questionnaire, but hardly any. In fact, in last 2 years, if I can recollect, I have come across just one person who actually designed a questionnaire very, very well. He also tested the reliability of the questionnaire and the validity of the questionnaire. So the point that I'm making is that even though detailed guidelines are available, many of us are not very clear as to how to design a good quality questionnaire. So we have used, we see examples where the inappropriate instruments have been used. The questionnaire has not been designed properly. There is a lack of rigor. So the same thing is being asked in multiple questions in different roundabout manners. So therefore, it leads to generating poor quality of data. The questionnaire questions are not framed properly. So therefore, to the respondent, they lead to misleading conclusions, and as a result, they answer wrongly. And all these will result in inconsistent recommendations. So we will see how this consistency comes in subsequent slides. So even see, what is it that we are trying to do? What we are trying to do is to get information that will guide our decision. That is the sole purpose of the questionnaire, that we collect data, we analyze that data, and what inference we can draw from that analysis, and then using that inference for our decision making. So what kind of decisions we need to make in the let's say in the day-to-day operations of the hospital? If we restrict ourselves only to the hospital management, we will be looking at patient satisfaction, possibly the services like the linen or the dietary services. We may be looking at, or we may be trying to collect data about how the staff behaves with patients. So we will ask the patient certain questions and we want to find out, is there a need to train the staff to conduct themselves in a certain manner. Sometimes we want to know whether or what are the competency levels existing for a particular skill. For example, let us say the basic life support or the advanced cardiac life support, and for that we need data to find what kind of intervention should be done. So should we conduct training for everybody or should we conduct training for a selected group of people? So these are the kind of decisions that we will be looking at on a daily basis in our hospitals. So therefore, the essential process to take those decisions or to help taking those decisions will need meaningful information, which will come from the analysis of the data that we will collect using a questionnaire. Like I said earlier, the data can also be collected by various means. Questionnaire is one of them. So what we need is meaningful information, which will help in decision making. And all the tools that we have talked about so far are the ones that will aid in converting existing observations or existing data into a meaningful information. So some of the examples of questionnaire that we very commonly use are the patient satisfaction surveys. Whenever we are conducting biosocial research, so whether it is a questionnaire being used in the MBMS or DNB thesis requirements, or it is being used in the MBA programs for the projects, or we are conducting client satisfaction surveys, training needs assessment. There can be variety of examples of a questionnaire which we use in the hospital. So next we come to what are the types of questionnaire. So based on the design itself, so we can have a structured, sorry, it is not structures, it is a structured questionnaire, or it is an unstructured questionnaire. Now, structured questionnaire is designed in a certain manner. It has a logic, a flow. The questions are asked, the answers are, you frame the questions and the options available to the respondent in such a manner that the answers are bound within those limits. For example, multiple choice questions. And unstructured will be the one where a questionnaire is not designed. There's no questionnaire itself, but you generally are aware that, okay, this is what we want to know. So let me give you an example for a structured and an unstructured questionnaire. So we have, whenever we use a formatted patient feedback form, that will be called a structured questionnaire, which has a fixed format and that is being given to everyone across the board. The second option can be that there is one patient care coordinator or patient services coordinator or a patient services executive who is there in the hospital, and he interviews the patients and asks the questions based on his value judgment, based on his perception. So therefore, the questions that are being asked to the patients are not same. Meaning thereby that each patient is not being asked the same set of questions, so that it becomes unstructured. It is dependent on how the conversation goes, but it is the questions can be different for different set of people, or different on two different occasions, even when the same person is being interviewed. So that's the unstructured design. Then you can have a questionnaire which is a type of questionnaire which is based on how it is being distributed. So you can have online telephonic questionnaires, you can have in-house where you physically visit the person and ask questions, or you can mail it. This is essentially the method of distribution, how you are sending a questionnaire to the respondent. The next is the type of questions that we can have. So these are the varieties that we have. You can have open-ended question. So open-ended question typically requires the respondent or the person who's answering to write a sentence or couple of sentences or maybe a paragraph. So typically open-ended questions are asked when we are not very sure as to what kind of data we are looking at. So we ask these questions so that we get a range of answers, and using those answers, then we we then make the close-ended questions. That means we limit the options for the respondents. Then you have a question which can be dichotomous, a simple yes, no. There is no third choice, so it is got only two options. Next is you can have a multiple choice questions, when all of us are very familiar with multiple choice questions. Then you can have a scaling question. Scaling question is, for example, the taste of the food being served in the hospital is good. The scaling options will be, strongly agree, neutral, uh, disagree, or strongly disagree. So this is a kind of a scaling question which you have, where you use a scale. Now there can be a variety of scales. We are not getting there because again our focus today is only on the questionnaire, but we will discuss scales and various scales that can be used. So we all are aware about the Likert scale, where you have typically an odd number of options, like 3 or 5 or 7 or maybe 9. Likert scale with 5 options is considered optimal, because of the ability of human cognition to differentiate between various options. And the Likert scale will typically have 5 points or 3 points. It will be a spectrum. So there will be two ends of the spectrum, which will mean that the person agrees or disagrees strongly, and then you have midpoint where it is neutral, and then you have additional points which is somewhat middle of the answers. So that will be a Likert scale. You can also have a rank order. This rank order can be decided by the person who's framing a question. You can have nominal orders. So there are various scales we can use. When we use a scale, this is when we call a question as a scaling question, which is different from all other options that we have seen. And then you can have pictorial questions. The classic example is the visual analog pain scale, or you have this pain scaling or pain scoring system, where you have pictures, smileys, or photographs or pictures. These pictures form the options for the person to choose. So that can be called a pictorial question. So these are the types of questions that we can have in one questionnaire. Now, it is not necessary to have only one type of questions. You can have a mix of all these variety of questions in one particular questionnaire. Now, what are the characteristics of a good questionnaire? So a good questionnaire is of a proper length. Now, what is proper will depend on what you are trying to investigate, or what you are trying to study, or what kind of data you are collecting. So the commonest one, let's say a patient satisfaction survey. So a patient satisfaction survey with maybe 2 or 3 questions is possibly too small, because you are not capturing the entire, a range of services about which you will want to know the satisfaction. And a patient satisfaction survey with, let us say, 50 questions will be very long, because the patients will find it difficult to answer, because it will take a lot of time for them to fill. Secondly, a large questionnaire obviously will need to be printed or administered or distributed in a manner which will have its own logistic issues. So a questionnaire has to be of a proper length. Now, what is proper will depend on what is it that you are trying to discover or collect data for. Patient satisfaction survey, typically 15 questions, 20 questions is just about enough. 2 or 3 is definitely very low. But some of the research projects on the clinical trials, when you use questionnaire, then you can actually have a large number of questions which are divided into various sections and such. So the length, what should be the proper length, is not defined anywhere, but once you frame a questionnaire and you do a pilot testing, you will get this feedback whether a questionnaire is of appropriate length or not. The questions should be easy and simple to understand. It should not lead to different conclusions by different people. Otherwise, you will not get the correct answers. If any technical term, or if any particular term has been used, or an existing term has been used in a different manner, then you must explain the terms that have been used in the questionnaire. It should be properly arranged, so there has to be a logical flow and the manner of writing. So, for example, if you are asking the questionnaire, you are administering a questionnaire for collecting patient satisfaction data. A good way will be to sequence your questions or order your questions in the order in which a patient usually comes through the hospital or goes through the hospital. So if you're asking satisfaction survey, then you could begin your questionnaire with access to the hospital, then the reception, then the billing payments, then the doctors interaction, nurses interaction, ward, etc. So this is a logical flow in which the patient has been through your hospital, and that's the flow to follow. It also helps the respondents to to recollect the experiences or the activities they have gone through and answer you correctly. Then complex questions should be broken into sub questions. So sometimes we have a question which can be complicated or which will have a little bigger scope. So when such a thing happens, we should always break down that question into smaller questions or sub questions which are easier to answer. It should be described precisely and correctly. You should have accurate. The questionnaire has to have accuracy. Now, accuracy will basically connect you to the reliability and the validity of the questionnaire. Now, what are the advantages of using a questionnaire? So, a questionnaire allows you to collect large amount of data. The questionnaire allows you to collect large amount of data in a very short time. Especially if you have designed a very good question and if you are administering that question online using online methods, then you can administer that questionnaire to hundreds or maybe thousands of people with very little effort. So that's the advantage, because then all those respondents get the same set of questions, and you get a data which is of a reasonable or a high quality. There is less chance of bias when the standard set of questions is used. It is quick and cost effective. There can be a rich set of features to design, distribute, or analyze the response data. Typically, when nowadays almost everyone uses online platforms for the questionnaires, sending and collecting data. Now, many of these online platforms allow you to not only send a questionnaire and collect responses, but they also allow you to analyze using the analytics tool like Tableau or Power BI from the Microsoft. So you can use these tools, and that's the advantage of using a questionnaire. The responses can be compared with historical data, especially if you have a questionnaire which is standardized, and therefore you are measuring using the same questionnaire over a period of time. And naturally, when you do that, you also can compare the responses of this month vis-a-vis responses of the previous months. Since a questionnaire is defined, it's a tool which is not open-ended. It's a tool where you have questions which are very clearly stated, and therefore it is easy to comply with data security and privacy requirements. In almost all studies, there will be requirements of maintaining certain degree of data security and meeting certain privacy requirements. So a questionnaire makes it easier. If you use other methods, of course, other methods can also give you data security and privacy, but some tools typically, for example, interview. Now, if you want to collect patient satisfaction data using an interview, then the privacy will be an issue. And you may not get the right answer because the patient or the person who's being asked a question in person, face to face, may not like to answer in a certain way. So the questionnaires avoid that possibility. Now, next about 4 or 5 slides, or maybe how many? About 10 slides, we will talk about selecting and designing a questionnaire. Any question so far? Anyone? So let us now go to selecting and designing a questionnaire. First and foremost is to decide what information are you trying to collect. You should have clarity on the kind of information that you are trying to collect, or the information that your study is going to generate. You will have to decide whether you are looking at qualitative or the quantitative information, and then if that quantitative has to be used, then what kind of scale that you need for your particular requirement. Classically, in biosocial research, a lot of time we use Likert scale, but ordinal scales and nominal scales can also be used. Qualitative information is about when you ask questions where the answers are they don't give you a numerical value. For example, you are asking a person's experience, or let's say quality of linen, or quality of interaction with the doctors or nurses. So there you may need qualitative parameters. You will have qualitative parameters to capture. Next is the questionnaire appropriate? Now, a lot of times we just jump at it. We think that let's make a questionnaire and circulate, because it seems so easy to make a questionnaire and to collect data. But we should also explore other data collection tools. Maybe the other tools are more appropriate than questionnaire. Participants must be able to give meaningful answers. So whenever you are trying to, if you think that your participants will not be able to understand the questions, or giving a questionnaire is not appropriate. For example, you have you are studying something about the elderly population, geriatric age group, and in that age group, if you give a printed questionnaire, a lot of them may not have the may have the visual acuity issues and may not be able to read properly. So your purpose of collecting data will not be served. Can an existing instrument be used? So this is an important understanding that we all should have, that it is always a good idea to use an existing instrument. So, for example, if you want to assess the patient safety culture in an organization, a good temptation will be to make a questionnaire and let's circulate the questionnaire in the hospital. But you would know that there is survey on patient safety. A validated tool is available. So that validated tool will give you a far better quality of information rather than using a questionnaire that you have made. So if you are making a questionnaire, please ensure that you have validated it. Otherwise, it is always a good idea to take a questionnaire which is already available. Now, many times the questionnaires may not be available in public domain. Many of them are available. For example, this survey on patient safety. It's a tool that is developed by AHRQ in US, and it is available. You can download it from their website. So when you use a validated tool, it allows you to compare performance. So if you use SOP's tool for assessing the patient safety culture in the organization in one hospital, and then you use the same tool in another hospital, then you can compare performance, or you can compare the measurement. Next is the questionnaire valid and reliable? Now, a valid questionnaire measures what it claims to measure. So the questions are designed in such a manner that the understanding of those questions by the respondent is same across your respondents. So it is not that one person will understand it differently and the other person will understand it differently, not like that. So that is the validity. And there, one example I've given here is a self-completion questionnaire that seeks to measure the patient's or people's food intake may be invalid, because it measures what they say they have eaten and not what they have actually eaten. So, example that we see of a similar situation in the hospital, when you have diabetes or hypertension patients and who come to you for review on a regular basis. So if you ask them, are you, following the dietary advice, or are you following the dietary restrictions? Most often they will say yes. Of course, there will be some who will very clearly say whether they are following or not. But most often they'll say yes. They don't, they don't. They have restricted salt, they have restricted carbohydrates, they have modified their diet in a certain manner. However, these measurements for the purpose of actual assessment may not be valid, because it is what the person is telling you. You have no other way to confirm this. So therefore, validity is an issue. And the next one is a questionnaire which is developed in a different time, country, or a cultural context may not be a valid measure. This is the biggest problem, and this problem has also no is now come on us for a totally different reason as well. In the fifth edition of NABH standards, we have a requirement of measuring PROMs. So PROMs are patient-reported outcome measures. Now, PROM has to be measured only using a validated tool, and most of the tools are priced publications. They are not freely available in the public domain. So the requirement is to develop your own PROM tool, your own PROM questionnaire, and that will require a validation. The another issue is, even if you get a paid version of PROM tool, let us say from UK or US or from any other country in Europe, the PROM, the patient reported outcomes, are surveyed using a questionnaire, and the manner in which a question is asked in, let us say, UK or in US may not be same as you ask in India. So therefore, when you just copy paste or transplant a certain kind of questionnaires like PROM questionnaire, then it will not give you the correct measurement. So this is another issue that we need to remember when we are taking a pre-prepared questionnaire, because in certain situations that may not be the option. For example, measuring PROMs. The next is reliable questionnaires yield consistent result from repeated samples and different researchers over time. So differences in results come from differences between the participants, not from inconsistencies in how the items are understood or how different observers interpret the responses. So this is an important part. This is to do with the reliability. I am deliberately not getting into too much of detail exactly to measure the reliability. There will be a separate session for this. Similarly, for validity also there will be a separate session. These require a lot of explanation, and there is some statistics to be understood in that context. So I'm not covering it here, but suffice to say that validity and reliability both are important for a questionnaire. A standardized questionnaire is the one that is written and administered to all participants, so that all participants are asked precisely the same question in an identical format, and responses are recorded in a uniform manner. This gives you a data which can be relied upon, and it is said that the standardizing increases the reliability of a questionnaire. The next issue to address while designing a questionnaire is, how should you present your questionnaire? So a questionnaire item can be open or closed-ended, and they can be presented in various formats. So you can have online, you can have tick boxes, rating scales, visual analog, symbols, pictures, or open-ended. Now, while making questionnaire, words to avoid. There are only few examples given here, but anything that there are many such instances. There are many other phrases and words which can be misunderstood, so they have to be avoided. The examples given here are frequently. So, do you have frequent pain? Is a question that will never be understood correctly, because frequent for one person can be every day, frequent for another person can be once in 3 days, frequent can be for one person can be maybe 4 times a month. So we are not able to quantify. So instead of asking frequently, we should quantify it and say how many times in a day or a month or a week or a year. Similarly, regularly. Now, what is this word regularly? Regularly simply means that it occurs at a periodic frequency. For example, it happens every every week or every month or every year. All of them are regular. So when you say regular, then it doesn't make sense unless you qualify regularly better. Commonly. Now, one of the I remember from my clinical rotations years back, the is to be one on the lighter side, of course. कि if पेशेंट से आपने पूछा कि आपको दर्द कब होता है, सो पेशेंट कहता है कभी कभी अक्सर होता है. Now you figure out what it means. कभी कभी अक्सर होता है. Basically, patient has not understood the question and therefore he gives you an answer which in his understanding is the correct answer but may not be the correct for your purpose. Another word to avoid is usually, many, some, hardly ever. Now these are words which always give give a different answer from different people in this. So even if you're using the same standardized questionnaire, but it has these words, so you will get answers which may not be comparable. Close-ended designs enable quick data aggregation using tools like Tableau or Power BI. Now, close-ended designs means you have limited the options that the respondent can answer. So you have 5 options, 6 options, 3 options, whatever options you have decided, but it's a close-ended. The patient cannot, or the respondent cannot just write anything that they feel. So these questions are easy to compile, easy to aggregate, and you have lots of business intelligence tools. The BI stands for business intelligence. So there are Tableau or Power BI, and there are many tools available. So these tools can be used for quick analysis of data for such questionnaires. Now, another aspect to understand is what else should be included in a questionnaire. So it is not just the questions, but we also have to provide information sheet for the participants to take away after completing the questionnaire. So it is a kind of an acknowledgement that they carry with them. Many of you would have seen when you fill a Google form which has been sent to you from somebody, it asks you a question, do you want a copy of it? So when you say yes, you put your email and the answers that you have given is mailed back to you. So it is a kind of that I also want to keep a record of what answers I have given. So that is that need is met like this. Always provide introductions to the study, the purpose of the study, how the data will be, how the data that is being collected will be used. Always thank the participants and always address privacy and confidentiality issues. So if you want certain questionnaires to be confidential in nature, then you have to ensure that it is protected for that purpose. So whether you are mailing it to the person or whether you are sending it on a WhatsApp as a Google form or any other method, or you're using any of those online tools, please ensure that you have addressed the privacy and the confidentiality concerns in the questionnaire. Next is look of the questionnaire. Now, questionnaire has to be designed well. So apart from the content of the questionnaire, you also have to worry about the presentation, the design of the questionnaire, and the color scheme and the fonts you are using. So if you use very small fonts, the senior people will find it difficult to read. If you use a badly designed color scheme, it will look odd, it will not be easily readable. If you use a questionnaire in a language which is not the first language of the respondent, then they may find it difficult to answer. Sometimes you may need to translate the questions, and when you translate immediately, there will be some loss of clarity in translation. So translation losses are possible and they happen. And the question should be easy to complete. How many times we have filled a form in the bank where the form has such small spaces that we can't even write our phone number or the bank account number properly. So when you are giving a questionnaire which has to be filled by hand, that is handwritten, then it should have adequate space for answers. Similarly, if you are circulating it online, then please ensure that on the screen, the laptop or the computer screen or on the mobile screen, how easy it is to complete. We need to figure out what is the sample that should be taken. So appropriate sample is required. We need to know the study population, the sample size, and the sampling method that we have used. The next one is important. We have to have approvals before administering the questionnaire. So when you are administering a questionnaire for a research study, yes, you need an ethics committee approval. So this is natural. All of us know it. So whenever we do a study in our MD, MS or any research program, we take the ethical committee approval, ethics committee approval. But whenever we are using questionnaire for collecting other kind of data, which is not research, but we are collecting data, patient satisfaction is one example. So whenever you are collecting such a data, always ensure that you take administrative approval from your top management. Please remember that nobody in the top management will like if you start collecting data without their approval. It is as if you are trying to snoop or spy into the organization. So therefore, when you are doing this, please ensure that you have taken necessary approvals from the administrative authorities, because that will help. That will make it legit. It will make it legitimate. It will avoid complications later. And no top management likes that somebody collects data in the hospital, for example, without their approval. Now, these are the two aspects I am requesting you to explore on your own. Of course, in future we will have a session on these two different sessions on these two: how to test the reliability of a questionnaire and how to test the validity of a questionnaire. There are methods available. We will talk about it. But in the meanwhile, it is a kind of homework for all of you. Have a look. It's an interesting domain, and once you see it, then you will realize how significant designing questionnaire is. These are the two downloads that I have, this particular presentation and one article from BMJ, selecting, designing and developing your questionnaire. I have finished. Thank you very much. I'm going to close this presentation, and if there are questions, we'll address them.
Hello, sir.
Yes, please.
Sir, I wanted to ask, you said suppose a validated questionnaire is already available, it will be good.
Yes.
Okay. So suppose a validated questionnaire from USA or UK is available. Some points we might not be able to use them. So can we modify it and still it is validated?
Yes. So if you take the example of survey on patient safety, let's take that example as a example for your question. So when you use a validated tool from, let's say, some other context, like in this case from US, the measurement of patient safety culture, okay, let's look at it differently. The patient safety culture requires same set of things to be implemented in hospital, whether here or there. Now, the SOPs, the Survey on Patient Safety questionnaire, if you look at, it has different sections, and the first section deals with the demographic data of the hospital. That is one part which you can change, because demographic data in this particular questionnaire is not part of the questionnaire, and therefore it doesn't affect your findings or your inferences. So that of course you can modify. But if you are modifying the questions which are there inside the questionnaire, then you may have to do a validation again. So that's the requirement. So like PROM questionnaire, the patient reported outcome measures questionnaire, are typically not easy to transplant, because they ask questions and the patient context there and patient context here is slightly different. So the translated questionnaires, let's say you've taken a questionnaire on PROM from let's say from any of the European countries or maybe UK, and you've translated that in Hindi. Now there can be a lot of loss in translation. Therefore, when you are using when you are using or measuring something like PROM, or let's just say something like patient reported experience measurement, then you have to make a questionnaire of your own. You can't take someone else's questionnaire. But in many instances, you can take and just ensure that the portions which need modification are not the ones which are included in the questions, so that they don't no, they don't interfere with the data that you collect.
Okay, okay. Sir,
Okay.
one more question.
Hmm.
Sir, you said the prom is mostly available in US and UK. Can you give one example, or can we have a download of one example of prom?
Most prom tools are paid priced publications. If you look into the in the learners portal in this Rafa Live, there is one session on prom that we conducted earlier. It was conducted some time back, but that's it. The recorded version is available, so you can have a look at that. If you still have questions, we can answer them, or you can ask directly also.
Okay. Thank you, sir.
Okay.
Okay, thank you.
So next will be 16th. 16th there is no session. I think there is an email also that must have been that all you all must have received. So there is no session on 16th on account of Dashra. The next week, that is on 23rd, we will have a session, and that the session we have already announced. Thank you very much and all the best, and happy holidays. Please stay safe and also maintain all precautions that are required for COVID. Thank you very much.